Welcome, everyone. This is our webinar this evening on treating hormone and metabolic conditions from the perspective of an OBGYN and an endocrinologist. So for this webinar tonight, we will be speaking with Dr. Stacy Henigsman, Doctor of Osteopathic Medicine and board certified OBGYN. She is our medical director at Allara. And we will also be speaking with Dr. Sonia Gibson, MD, who is a board certified endocrinologist. Thank you both for being here this evening.
Thank you. Hi.
Hello. So I would love to just get started by doing an introduction of the both of you. And I'm going to start with Dr. Gibson, who is our endocrinologist. Dr. Gibson, I'd love to ask you if you can please start by giving us a little bit of an explanation of what is endocrinology and tell us a little bit about your practice of endocrinology.
Of course. Hi, everyone. I'm Dr. Sonia Gibson. I'm a board certified general endocrinology, diabetes, and metabolism specialist. I've been in practice for 12 years now, and I've been managing PCOS pretty much throughout my practice. I'm very, very passionate about PCOS, metabolic disease, and women's health. Endocrinology basically is the study of hormones, metabolic disease, and diabetes. It's kind of all bundled together. So hormone imbalances we treat. The hormones affect every organ system. So when there's hormone imbalances, there tends to be a lot of body systems that don't work. So our job is to fix that, to diagnose it and to fix it. So pretty much the study of hormones and metabolic disease.
Fantastic. Thank you so much. We're very lucky to have you here as our resident endocrinologist. Dr. Henigsman, I'll move over to you. And if you can please just explain to us, I'm sure this is a bit more common for most people to understand, but I would love to just hear your take on what is an OBGYN and how do you practice on our platform?
Yeah, thank you, Danielle. I'm really happy to be here, and thank you, Dr. Gibson. So as Danielle introduced, I am Dr. Stacy Henigsman, a board-certified OBGYN. I've been practicing for upwards of 20 years in seeing PCOS patients. And what an OBGYN really is we are doctors that have special training and education in women's health care. So we are dedicated to the medical and surgical care of women throughout their lifespan. So we see patients from puberty all the way through menopause and everything in between.
Excellent. Okay. So as on our platform, something that is so important to us here, and Dr. Henigsman, you've been so instrumental in bringing about this collaborative care model between gynecology and endocrinology, specifically for the treatment of hormone and metabolic chronic conditions, PCOS, and the others that we treat on our platform. So I'd love to hear just a little bit about why that collaborative care model is so important to you to practice on this platform.
Yeah, absolutely. So PCOS encompasses so many conditions. So it encompasses the reproductive and hormonal aspect. It encompasses the metabolic aspect. It encompasses really every organ system. And so it's really important for me to have a endocrinologist and a nutrition team that I can rely on. If I see anything that is a little bit unusual that I haven't seen before, I'll always ask Dr. Gibson, see if she can provide some guidance. For our other patients, lifestyle changes are so important. So the nutritional aspect, the dietary aspect is really important. So the collaboration between the gynecologist, the endocrinologist, and the dietary team is really vital for the success of Allara.
Fantastic. And I know our patients are extremely, lucky to have both of you and the nutrition team on our platform. So I have a question. This is a question that comes up all of the time through social media, whether it's through our social media or social media on the grand scale. And even when we see patients that come in when this is their first time entering a collaborative care model, they may have some misconceptions about the type of doctor that they need to see. So I know this is a bit of a controversial question, but I'm going to ask anyway, because I'd love to hear what you both have to say on this. Is either an OBGYN or an endocrinologist better for treating PCOS or another chronic hormonal and metabolic condition? Dr. Gibson, would you like to start with that?
Yeah, well, the easy answer is no, none of us are better or worse. We both, PCOS is a condition where there's both overlap on the endocrinological and gynecological aspects, and both specialties have training in dealing with both the metabolic and the hormonal disbalances that PCOS patients have. So there is not a better doctor. It's not like the endos or the gynecologists treat it better. We follow guidelines. We don't, use unconventional treatments. So when you're following the guidelines of PCOS, of course, an endocrinologist and a gynecologist can treat PCOS effectively because the knowledge is the same. So really the importance is, does your provider know what they're treating? Whether they're an endocrinologist or a gynecologist, do they know what the newest guidelines are, what the data is, what the evidence medicine shows? That's really the most important. It's not really the label of, is it an endo or is it a gyne?
Mm-hmm. Yeah, I love that. I think that's, again, something we speak on a lot here is the caliber of practitioners that we keep on our platform, is that just high degree of specialization in these conditions that are very difficult to treat. So I'm glad to hear your perspective on that as the endocrinologist, that you think it is important to have the knowledge of the condition itself.
Correct.
Dr. Henigsman, same question. Who's better?
Well, again, neither one of the specialties are better. And so I always like to say it's not the specialty, it's the specialist. And so I will speak for all gynecologists out there. We can all treat PCOS. We all know how to treat PCOS. We've all studied PCOS. The problem is it is such a complex condition that in the specialty of gynecology, people will specialize in surgery or they'll specialize in other small things. And so they don't keep up to date with the newest guidelines on PCOS care. So it's really not a matter of, which specialty am I going to get treatment from? It's really a matter of who is your specialist? Are they updated? Are they listening to you? Do they care about what's going on? So it's really more of the doctor specifically and not what the specialist they fall under.
Fantastic. So one last question for you both, as we're kind of sussing out who our specialists are and why this is a collaborative model and how this is effective. I would love to ask you, Dr. Henigsman, if you can share a success story or a specific case that you've worked with where the collaboration between the gynecologist and the endocrinologists resulted in improved outcomes for a patient.
Yeah, of course, I'd love to. So I actually had a patient that I was treating for PCOS, and she came back with a large benign pituitary mass. And I actually sent her to an in-person endocrinologist. I got all the referrals back. I read everything, but something just wasn't sitting right with me. So I actually reached out to Dr. Gibson and I wanted her to look over everything. And so she looked over everything and she agreed that there was some things in the care that just weren't quite right. And so I actually transferred the patient to Dr. Gibson. And what is really cool about it is the patient didn't have to make an appointment with an endocrinologist, an in-person endocrinologist that was going to have to take 4 or 5 months to see. She didn't have to get in her car. She didn't have to drive. She didn't have to sit there. She actually got to see Dr. Gibson a week later and got all of her care online. And so it was really super convenient for her. She got expertise care from an endocrinologist. So that's just one story of many that we can tell on the platform.
Amazing. I'm so grateful that you both are able to offer that type of care to our patients.
So unfortunately, no, the answer is that they're not curable, but certainly treatable so that you can live a normal life and control your symptoms and meet your goals as far as your health. So yeah. Anything else you want to add, Dr. Henigsman?
Yeah, I mean, so we treat on our platform, we also treat endometriosis, menopause, menopausal transition, metabolic syndrome, which Dr. Gibson already spoke a lot about. And so menopause and the menopausal transition, it's not curable or not curable. It's just a process of life. So you have puberty, lifespan, then menopause. So we're all women are going to go through it. And so it's something that we treat, we see what your goals are, what you would like, and we treat that. Endometriosis, unfortunately, is a chronic condition that is not curable. It's treatable as, PCOS, but it's not something that you can cure. And so that also medication, surgery, things like that. And so unfortunately, the majority of our conditions on our platform are not curable, but very treatable.
Great. Okay. All right. So another couple of questions. I think, again, one of the most common questions that we get about the types of conditions that we treat, especially with PCOS, that's really difficult for some people, is how would we feel about somebody who is struggling with their weight, and when they're feeling like there isn't very much hope for them to be comfortable in their body with having PCOS or having another chronic condition? Can we talk a little bit about how you both will listen to that patient and kind of talk through their symptoms and just, help them on that part of their with that part of their care? Dr. Gibson, I'll let you start a little bit with that.
Yes. So it kind of goes back to what we were talking about before of patients, number one, being undiagnosed for years. Once they are diagnosed, they're not really given the proper guidance. They are told, no, you need to go on birth control and lose weight, and I'll see you in 6 months. That's the typical PCOS care you'll get in the traditional medicine. So the first thing that I like to do when I meet my patients for the first time is to really go over their history, starting from their first period. We go all the way back to their first period, see how long have they been struggling with this, what measures have they done, what treatments have they done, and really emphasize that it all starts with lifestyle changes. I mean, medications and supplements can be added, but we never omit the lifestyle part. So lifestyle is super important for healing in PCOS, not only body healing, but mind healing as well. So the nutrition counseling is very important. It's one of the most studied effective treatments for PCOS. So when they feel like they're doomed and they're like, oh, I'm struggling with my weight, I've tried everything. Again, I go over their history and it's, what have you tried? Because most of the time what they've tried is not really what they were supposed to be doing. Restrictive eatings, yo-yo diets, diet this, diet that, following this food blog, this social media blog. They really haven't done what they're supposed to do, not because they just haven't had the proper guidance. So when you really talk about the patient and you really get really in depth about what types of treatment they've done, for the most part, they have not done the proper treatments and the proper modalities that you need to do as far as lifestyle changes for PCOS. So when they feel that they're doomed, I tell them they're not doomed. There's hope, and it's a chronic condition. It doesn't get, fixed from one day to another. It takes time and patience and consistency, but no, they're not doomed. Absolutely not.
That's so important, just to give a little bit of hope, that there's so much hope now, especially with the kind of collaboration that we have here, that it really can, they can feel more comfortable and can live.
Yes, it's very difficult. If it were easy, Allara wouldn't exist. It's very difficult. So It's important to offer the proper guidance. Absolutely.
Yeah. And I know we had our last webinar with Felice, who's our lead dietitian, speaking a lot about the importance of nutrition and of kind of breaking down some of those kind of long held ideas about what diet should be for patients. We'll actually be doing another session with Felice in a couple of weeks to talk more specifically about nutrition and kind of that importance position to care too. So always wonderful that you as the practitioners are open to that kind of collaboration. Dr. Henigsman, I know you've been so instrumental in designing our curriculum, and bringing on great practitioners, especially kind of the collaboration and really enhancing the collaboration with the nutrition team. Would you like to talk a little bit about that when it comes to this kind of big question about weight and PCOS, how our patients feel about that?
Yeah, and so I think Dr. Gibson really hit it when she said a lot of patients, and I kind of said it too, they're patients with PCOS have fallen through the cracks, and so they're searching for everything, right? They're looking for anything. So where do they go? They go to Instagram, they go to TikTok, they go to blogs, they go to all this stuff, and they hear all this noise. And so what I think is really important is to educate the patient. I mean, I think that's my job, is to educate the patient and tell them what really science says, like what works, what doesn't work, really simplify it. And I think that's what's so great with our dietitians, because they're registered dietitians. Our patients get paired with them, and they're going to go over all of their, lifestyle, their supplements, their diet, their movement. And I mean, studies have shown that you can lower your cholesterol by 30 to 40% with lifestyle alone. So lifestyle is so huge. And I think people are getting the wrong messages. And so I think we kind of just take the noise out of it and really just simplify it. And I think our registered dietitians are instrumental in that, because they're all knowledgeable on women's health, knowledgeable about PCOS care and all of the chronic conditions. And so I really think that this platform wouldn't be as successful without our dietitians.
No, 100%.
Awesome. Thank you. Okay, so this is kind of an interesting question here. And it's, I think, again, something that we see a lot, where patients come and they want to understand kind of why this is happening to them. Like how did they come to this point where they, might have PCOS or another chronic condition? Can you both maybe give a little bit of your expertise on how this kind of runs through families? What are some of the, kind of genetic factors that play into it, and that, kind of that as a root cause? Dr. Henigsman, I'll let you start there.
Thank you. So why does PCOS happen? We really don't know, but we do have some really interesting studies that there's definitely could be a familial component. They actually looked at 16,000 patients from China that actually had PCOS. They looked at the genetics of it, and they actually located a gene that was mutated in these women, different loci, but a similar gene. So that points to definitely a genetic component to it. And so we definitely think there's that. There's also a huge lifestyle component to it as well. And so while we don't really know what causes it, we do know likely there is a strong genetic component, as well as other things that have yet to be discovered.
I think if you also pair some significant family history as well, not only PCOS, but metabolic disease, diabetes, hypertension, I think also these patients tend to have a little more predisposition of developing PCOS. It's like, does your mom have PCOS? No, but she has diabetes. And does your sister have PCOS? No, but she's obese. So there's also some predisposition about with metabolic disease later transforming into PCOS in some of these patients as well.
Yeah, definitely.
Okay, yeah, great. All right, so we do have a little bit of time left here. We do have a lot of specific questions about specific conditions, again, that we treat here, and kind of what is the best approach for treating Hashimoto's, for treating PCOS, for treating different thyroid conditions. And now, as we practice, I know that our answer is that it is very different for each person. So I'd like to kind of just give a broad, sort of bundle a bunch of these questions up together and give a broad question to both of our practitioners about how do we treat when somebody is coming to us with a specific condition, how do we treat that condition on a personal level with that individual, whether they have Hashimoto's, whether they have a thyroid condition or a metabolic condition or PCOS? Dr. Gibson, you want to start there?
So how we treat individually a patient who has a specific, well, the way we always treat patients is we get a very thorough history taking, a very thorough physical exam. Obviously, through a telemedicine practice, it's a little challenging. There's some limitations on the physical exam, but the beauty of PCOS is that most of our data can be obtained just by talking to the patient. So it really depends. Yeah, everything is very personalized. There's PCOS spectrums where patients have severe insulin resistance. So we really focus on treating that, along with a hormonal imbalance. But there are other patients that have, they're lean PCOS and they have more of the hormonal imbalance. So it's a very individualized approach, 100%. Not every patient gets, there's standards of care, of course, but every patient is different. I think the lifestyle part applies to all of them, not only PCOS, even thyroid, diabetes, metabolic disease. The lifestyle is pretty much always present. And then, of course, when we get a little bit more into depth about, history taking and what's going on, if there's other mental health issues, we really need to address that, also individualize that, because if the mind is not healed, the body can't heal either. So it really depends, really, what the patients are experiencing. All PCOS, all these conditions need to be individualized because, every patient is different. Some patients have side effects to medications, react to medications differently, benefit from medications differently. The most important thing is to provide a whole care where you're treating not only body, but also mind, reaching goals for the patient. I always go over each visit, we go over goals and see, have we met this goal? Not yet, but this one we did meet. Okay, for our next visit, this is going to be our goal. And really focus on progress, not focus on perfection. And, we need to be cured by next visit. No, but I want to see progress. I feel better in this standpoint. This hasn't gotten better yet, but certainly this is better. Okay, great. So guess what? On your next visit, this is going to get better. And I think treating the patient that way with a realistic approach, rather than unrealistic goals is very important.
Perfect. And Dr. Henigsman, I'm going to kind of give you the same question just to wrap up for our session tonight on, again, because we do treat now on our platform multiple conditions. So I would love to just hear your take as our medical director on how we do treat on a very personal level for any of the conditions that are on our platform that we specialize in.
Yeah, absolutely. So I think I'm going to kind of reiterate what Sonia said. For my patients, I want to know what their goals are, because a PCOS patient may want to get pregnant quickly. Another PCOS patient may not want children whatsoever. Same with endometriosis. Some patients want to get pregnant. Some patients have really bad pain. So you really have to individualize it, and you really have to ask the patient what their goals are. Obviously, there's going to be similar things across all the spectrums. Like if they have PCOS, we're going to want to treat their insulin resistance. We're going to treat their, their weight, their acne. We're going to treat all of that. But we really need to figure out what the goals are for the patients. And so that's my number one thing is goals. And I also see myself as a cheerleader kind of in their corner. So when I see them, I'm like, you're doing awesome. I mean, I saw one patient today. I could not even believe her labs. And it was in 3 months. Her labs are so good, so wonderful. And I had to tell her, I was just amazed that she's done such a good job with everything. And she said to me, well, I'm really listening to what my dietitian says, what you say. So really it's figuring out what the patient's goals are and being a cheerleader in their corner to celebrate with them when they reach those goals.
Amazing. Well, again, we are so lucky to have you both, and thank you for taking some time this evening to share your experiences with us and your expertise with us. I hope that everybody on this call tonight got something out of it that you can take with you on your own journey, whether that's with us or just some information that you can glean on how to kind of, better care for yourself. We super appreciate you. This will be recorded and distributed I'm going to end it here. If you have any follow-up questions, you will receive a little follow-up. So please, don't hesitate to reach out to us with any questions. And once again, thank you so much, Dr. Gibson and Dr. Henigsman.
Thank you.
Thank you both.
Bye-bye.
Bye.
Bye.